When we talk of non-communicable diseases, somehow or other we immediately jump to the curative aspect. We think of cancers, we think of lung diseases, we think of heart diseases, and you wonder, Dr. Asmus Hammerich, Director of Non-Communicable Diseases and Mental Health, the role of curative versus prevention with non-communicable diseases.
Well, thank you very much, and this is a great opportunity for us to discuss the importance of both the prevention and the control, in other words, management of non-communicable diseases and mental health. When we say non-communicable diseases, we mean mainly the cardiovascular diseases, chronic lung diseases, diabetes, and cancers.
Okay.
They do represent almost 2/3 of all causes of death in our region, and that is coming up to 2.5 million deaths a year. So whatever efforts we do in our region, NCDs are in the center.
Dr. Hammerich, I mean, you said 2/3 of deaths in the region. Is that all across the region, or does it differ from areas where, like the Gulf countries, for example, where they're more advanced, and others where the communicable diseases may have a bigger load? So what is the...
Thank you. Every country is different, of course, and we do have a great diversity of communities and countries in our region. Whilst some countries, because they're in crisis or they don't have the economic means yet, do struggle more with management and control measures of NCDs, all countries face the same risk factors.
Absolutely.
And in fact, some of our wealthy countries do face a lot of challenges when it comes, for example, to physical inactivity.
Okay. If I were to ask you to give a message directly to people who are watching us, what would you say in order to avert as much disease as possible?
Yes. My message number one would be that our joint efforts against non-communicable diseases and for mental health are critical in our region, and we cannot reach our sustainable development goals and universal health coverage without focusing on the effective interventions that are available, the so-called best buys for NCDs and mental health.
Okay. What are the best buys?
The best buys constitute a package of evidence-based and feasible interventions that focus on the reduction of the important risk factors, namely tobacco, unhealthy diet, physical inactivity, and alcohol abuse, also air pollution, which is increasingly important, and at the same time trying to reduce the diseases that we mentioned earlier.
Thank you very much. So what is in the hand of the public is, of course, to reduce smoking, to reduce drinking, physical exercise, a lot of things that a person can do. Air pollution, it's the government efforts as well. Thank you very much.
Indeed, pleasure.
Thank you.
Thank you.